everyone, welcome back to my health channel. Today I'm going to talk about something that I think a lot of us face or will face in the near future. So my dad has been diagnosed with dementia. His diagnosis was made a year ago, and it's related mostly to his cardiovascular complications. The challenge that I have at this moment is dealing with my siblings. I am the oldest of four, and I've been pretty much out of the picture. I'm getting back into the picture because I'm the only family member that have experience in the healthcare field. I know there are a lot of other families dealing with family dynamics, sibling dynamics, and so on, caring for your parents. My mom has been the primary caregiver for my dad. She's done all the housework, and just most recently, she was okay to hire a cleaner, but the challenge getting my mom to do that or offer or accept help is really her upbringing, the fact that she's done this in taking care of my dad throughout their marriage. It's kind of a new thing for her to really think about outsourcing help. But I think in that generation where the spouse, usually the female, care for the household and the children. So this is kind of the upbringing as a caregiver. There is extreme a lot of stress and burden that's involved. So I'm trying to give my mom some tools in order to help her. I did get a call, and my mom was saying that my dad's mobility has declined. He used to walk pretty much every day. He did have an OT, occupational therapist, come and help him once a week after his heart surgery. And that was about a year ago. After a couple of sessions, he decided that he didn't really need this T anymore. And the thing about health and someone's illness is that once you feel better, you feel like you don't need the medication or any of the other medical aid. He's been walking with his cane, and lately, as my mom had stated, he's no longer interested in walking. He does have to exercise because you really want that cardiovascular strength as well as the bone strength and flexibility. So you do really need to exercise. The last month or two, apparently, he's been not wanting to do that. In fact, she mentioned that he hasn't taken a shower for 2 weeks. I asked her what she was thinking about in terms of getting him to do more things mobility-wise. She referred back to the OT therapist that came and helped him walk, and she wanted someone to help him walk. So I asked her whether she wants someone like that, and she said yes. So rather than hiring a home health care nurse or a nurse's aide, I decided to call his primary care and inquire about an appointment. The appointment is going to be 3 weeks from now, which is, I think for appointments, is kind of too long, but they do have a telehealth option, which I told them that my parents are not tech savvy, so I'm going to have probably one of my sisters help them navigate the first telehealth care. My siblings and I have had a bit of a run-in because really I'm not sure. Last year, my dad had made my sister power of attorney with the finances and his medical care. After that, it seems like every time I do something for my dad, the sister who is the power of attorney, she appears to be somehow jaded in terms of what I've done for my dad. I did call her on the fact that she didn't think my dad's dementia was dementia. Without even going to the doctor, she just said that's how that dad is. I left my mom alone in the casino for hours. I told her that you can't think of your parents as they get old, that it's normal for them to get confused, because based on my mom and that episode of confusion, it was not like him. And being in the healthcare field, I understand what dementia looks like. We've seen patients that come in, patients with Alzheimer's, vascular dementia. I knew there was something that was wrong and that needs to be addressed. After that, and after helping my dad get a different Medicare Advantage, she's been a bit of a barrier. I find that it's really hard for me to tell my siblings what my dad needs at this time. And it's not just what my dad needs per se. Given that my mom is caring for him 24 hours, she's going to need some help. Right now, she says that she'll let us know if she requires any outside assistance. And that's okay. But the fact that she called saying that my dad hasn't taken a shower for 2 weeks, that's alarming to me. me because that tells me that his mobility, all that is diminishing. I send a mail to my other sister who is not estranged from me. She said in the email, I'm going to bounce this to my other siblings. I said, this is what Mom asked. In reply to that email was that, well, I visited Dad just recently and his mobility or his walking is the same as last year. And the fact that they go to casinos every month pretty much negates what my mom observed or said. Having felt that they no longer want me in their decisions about my dad's health and his health care, I said, don't make any observations based on your lenses. Ask Mom if Dad really needs it or whether he doesn't need it. But don't assume or don't have these biases just based on your observations, especially if the person who's taking care of that person is asking for help. Also, because they know better. Okay, out of all the other siblings, we don't live with them 24 hours. My mom knows him the best. So if she's asking and is observing that my dad's not walking anymore, then we need to go ahead and step in. I'm right now out of the country. I really can't do anything at this point. And also my dad's diabetes, which he's had 3 decades for now. His A1C, I mentioned this in the other video, was well over the normal high. It's around the 10% where it tells the healthcare providers that his diabetes is out of control. The thing that is so frustrating for me is that there are so many negative consequences of uncontrolled diabetes. The list is long. They're life-threatening in some cases. Unfortunately, trying to relay this message to my siblings is coming into one ear, coming out of the other ear. I heard my brother comment how my dad is old now, so why not let him eat what he wants to eat? And to me, as a healthcare provider, it's really hard for me to listen to that. Because yes, we could let him enjoy things that he likes to eat, but there's a fine line between not caring and neglect, meaning that you know there are consequences, bad consequences of not controlling your diabetes and then letting it go. And not having my dad and educating him, and he's had diabetes nurses come and visit him, and he's good for maybe a week or 2. And I understand that at his age, yeah, he does want to eat whatever he wants to, and I get it. But to do that every day and not really think about your uncontrolled glucose level is really not a good idea. In terms of his physical and occupational therapy, you do get some help from Medicare. There's a cap that you could use that money for physical and occupational therapy. It's under $2,500 per year. Now, the thing is that if you want to initiate OT, PT therapy, you need to have it initiated by a medical doctor who could place an order and get that going. Because in order for Medicare to pay for it, you have to have a licensed physical therapist and an occupational therapist. There is another route we can take, which is essentially hiring someone outside of that Medicare world, which is outsourcing it. And luckily, my parents have enough money that they've saved for this kind of situation. And this is what I don't understand. That one sibling who has the financial power, it appears to me they're not taking the necessary steps. What I proposed was, let's hire these outsourced home health nurses that can come and help my dad move. The cost is around $30 on average, more if you're living in a state like California or New York. It can go up as high as $40 an hour. But I think that's good money spent. Even that, I get pushback. They've kind of pushed me out in terms of helping my dad. I could only tell them what's going on because the last time I stepped in, got him all prepared for his heart valve replacement. After all that, yes, he gained more of a better health quality because he was no longer short of breath or fatigued all day. I'm at an impasse, and one of the things that I think I could do is give the information to my mom. If she wants to, she can ask my sister that this is what I want to do. It's going to cost this much money. Pay it out of the trust account because that's where all the money is now, and leave it at that because I no longer have any power to do anything in terms of getting them the help which really makes me angry, makes me sad. But what I could do, and my husband had said, is that in the future, is to have my mom give me the power of attorney to care for her. Because I'm looking at my siblings at this time, and we've had multiple discussions and fights about this. And the fact that my mom is taking care of my dad 24 hours a day, he really needs to be in an assisted living facility. An assisted living facility, all my siblings were shocked that it costs so much. And I don't understand why they would have expected different, because healthcare system is expensive. And just to even get a physical therapy or occupational therapy, you have to call your primary care, make an appointment, which could be up to a month, and see if it meets the criteria of Medicare. And a bit mind-boggling, I think, to really see how the system works based on and taking care of my parents. As I grow older and I reflect on these dynamics between my siblings, I don't have any children, so I'm in one sense glad that I'm not going to burden my kids in making all these decisions, because I realize that some people, they just can't because they don't have the knowledge. And at this time, ignorance is not bliss, because they really don't understand the need of my dad, need of my mom as a 24-hour caregiver. They still think that my dad could make these decisions on his own. And that's far from reality. So the suggestion I could give to people that are in my situation is to provide as much information and resources that's available. Let them make the decision, because at this time, I'm not physically there, and I don't have the finances to do the things that are necessary. If I had it my way, I would definitely put my dad in assisted living where he can be cared for, where there's staff to help him walk, where there is people that will feed him, give him his 3 meals, which means my mom doesn't have to cook for him 3 times a day. And also, if he happens to fall or have a medical crisis, they could also help with that. And they could also help manage his diabetes as well. It's no fun being in assisted living or those memory care. My mother-in-law was in a memory care facility, an assisted living facility, for a whole part of COVID. And that was a very strange situation indeed, which I'll have a different video of that later on. In some cases, you got to do what's best for your family. In my case, I can just provide resources and give my siblings essentially an update of what my mom is asking, and leave it at that and hope for the best. If there's an emergency and I have to intervene, of course I'll intervene. Otherwise, I could let my mom know the numbers of the home health services available in her area and have kind of a conversation with my mom about that, and let her know that it costs X amount of dollars for that to happen, and that she wants this and she needs to relate that to my sister who's holding the account. I will update you on my dad and my mom. Their health is declining. Right now, there's so much dynamic with my sisters that coming together as a team is just not happening. I'd like to hear from you if you have dynamics like this with your siblings or whether your kids. How are you doing? What are some of the solutions? And I don't even know if there's any good solution except for just helping when you can, right? So until next time, everyone, please take care of yourself and your loved ones. Stay safe and stay healthy. Bye.